Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week, we talked all about food sensitivities. So if you are thinking that you might have a sensitivity to a food or an intolerance or maybe an allergen, go back and listen to that episode. This week, we're going to be talking about progesterone versus progestin. And the reason I wanted to bring this up is because it's a common topic in practice about progesterone and the side effects or maybe the negative side effects that you might have heard about progesterone. However, progestin is the one that we actually want to make sure that we're avoiding because that's the one that can cause a lot of these side effects. So progesterone is made naturally in our body by our corpus luteum, which is a mass of cells that form in an ovary, which then helps produce progesterone when we ovulate. So we make progesterone only when we ovulate, and that happens about day 14, 16 of our menstrual cycle. Progestins are synthetic progesterone that is commonly found in birth control. So it can be in different forms. Two common ones are medroxyprogesterone, which is found in the Depo-Provera shot, and then the levonorgestrel is progestin, which is found in the IUDs such as Mirena and Kyleena. Now there's tons of other birth controls that contain progestin, and this is the synthetic form of progesterone. Now progestins prevent pregnancy by inhibiting ovulation and reducing the amount of mucus that we have, the cervical mucus, which makes it unfriendly to sperm that are trying to enter the uterus, which is how we use birth control to prevent pregnancy with progestin. So there's also a misnomer out there that progesterone is good for the mood. And yes, it is, but progestins and in the synthetic form of progesterone is not good for the mood. So I wanted to point out some differences between progesterone and progestin. I am a huge proponent of progesterone. I call it the queen of hormones. And this is something that I do a lot of hormone replacement therapy for, is the bioidentical, or what our body is trying to make or makes naturally, form of progesterone, which happens when we ovulate. If you're not ovulating, you're not making progesterone. So a lot of my patients that have menstrual irregularities, perimenopause, menopause, their ovaries are not working. Perhaps maybe you have polycystic ovarian syndrome. This is a huge reason why you might not have progesterone if you're not ovulating. So progesterone is very protective and helpful for cardiovascular health, whereas progestins can actually cause and contribute to higher blood pressure. Progesterone can actually help with hair growth. So a lot of women that are experiencing hair loss or thinning hair, especially menopausal women, it's a very big sign of menopause as your hair thins. This progesterone or bioidentical replacement of progesterone can stimulate hair growth, whereas the synthetic form of progesterone, the progestins, can cause hair loss. So keep that in mind. If you're on any sort of birth control and your hair is thinning, it might not be your thyroid, that's a common symptom. It could be the actual birth control causing some of these symptoms. Another big one that I mentioned was the mood. So progestins, the synthetic form in birth control, IUDs, can cause anxiety and depression, whereas progesterone in its natural form is actually very calming to the brain and the nervous system. It's something that we give at bedtime because it promotes restful sleep. It's an anti-anxiolytic, and it can help with sleep if you are one that is super anxious or having trouble with sleep. That's why we dose progesterone at bedtime for the most part. Also, progesterone is very protective against breast and endometrial cancer, whereas the synthetic form, or progestin, can actually increase your risk of breast cancer. So keep that in mind if you're on any sort of birth control. And then the other one that is very common is that the progestins can be androgenic or testosterone-like, so they can actually contribute more to facial hair growth, acne, hair growth in unwanted places too. So that's the more androgenic form of the hormones, whereas progesterone has the anti-androgenic effect. So it can actually help reduce some of these androgenic side effects. So I wanted to point that out because a lot of, I dose my progesterone from a compounded pharmacy, which is the more bioidentical and mimics what our body is trying to make naturally. Whereas you can buy progestin in a synthetic form of progesterone over the counter. And then again, if you're on any sort of birth control, it's likely found in there in the forms of levonorgestrel and medroxyprogesterone, which are the two common ones. But again, I would look up your birth control and see if you have the synthetic form of progestin in it, because it might be causing more harm than good. So again, short, sweet, to the point episode talking about progesterone and progestin. Hope this was valuable for you, and we'll see you all again next week.